Wonderful evening, and it's fantastic for Daisy and I to be able to partner with Hands Up for Syria. And David, it's wonderful to see you again. But I last saw you in Hay at the end of May. Things have got worse, haven't they?
Yes. So we run a foundation. It's called the David Nott Foundation, and we train surgeons from around the world, and we bring surgeons from all over the world to come to a course in the United Kingdom. But we also take the course to abroad, and since I saw you, I've been in Idlib. We went across the border into Idlib with loads of suitcases full of equipment that we're showing the surgeons how to deal with their cases. It's an intensive course which deals with general surgery, plastic surgery, pediatric surgery, obstetrics and gynecology, and orthopedics, and so on and so forth. All the things that they would see in their hospitals. We're trying to give them the best training they possibly can. So it was fantastic, really. They got 30 surgeons up from southern Idlib. We were over the border and in a Syrian hospital, and we did our 4-day course. And also, I spoke to the surgeons, I spoke to what's going on, and so forth. And the situation there was, to an extent, they said it's bad, but they can cope. And what was happening is at the time there was almost carpet bombing of the southern Idlib, going north all the way up. The Russians and the Syrian jets were bombing their towns, and civilians were unfortunately being displaced into the countryside, and some of their hospitals were being bombed as well. And of course you be in touch with them, you're in touch with them all the time, and but the situation is getting worse, and the doctors that we trained always are in touch with me and telling me what's happening, and also discussing cases that they like to just, what can we do here, David, and so forth. And I'm always backwards and forwards trying to do what I possibly can. But in the last 2 days, 4 of their hospitals have been destroyed. And if you look at the statistics, this is only in southern Idlib, which is, quite a significant area now. It's probably the size of the Isle of Man, really, or the southern part of it's the Isle of Man. There have been 65 hospitals have been destroyed. 51 healthcare workers have been killed. 84 have been injured, and so I'm sort of getting this all the time from my colleagues. And of course, OSAM, the Union of Syrian Surgical NGOs, are doing a fantastic job. They're putting out all the time about what's actually happening. Who is reading it, I don't know, but I'm reading it. Who else is reading it? Who else can make some decisions about what's going on? I don't know. And OSAM sent me something from the Washington Post, which was really shocking. They'd got the transcript of a Russian aeroplane with an air traffic controller talking to the Russian aeroplane, and the Russian aeroplane giving the coordinates of one of the hospitals that had been given to the UN, which had been distributed around the place, so they knew it was a hospital. And the coordinates to the air traffic controller, that can I bomb this hospital? The message was, yes, you can bomb that hospital. And they have documented evidence of 4 bombs blowing up that hospital and completely destroying it.
And what happened as a result of the Washington Post publishing that?
Nothing. Nothing has happened. And of course, it went to, people said, gosh, this is so horrible, this is terrible. But what happens? Nothing happens. And I understand from the Washington Post, they went to the Russian president and said, your Russian planes are actually blowing up hospitals that are being built and they're underground hospitals, because they can't afford to have hospitals overground because they're going to be completely destroyed. And the Russian president said, no, it's not happening, and completely denied it. And that was that.
That's astonishing. You've been, your wonderful book, War Doctor, and you were in many places before you found yourself in Syria, but you write a lot about being in Aleppo. Describe to us what it's like actually trying to help people when you're being bombed, when you're in a war zone like that?
Well, the hospital I worked in Aleppo back in 2013 and in 2014 was about 100 yards from the front line. And you could hear, gunfire, you could hear shells being dropped, you could hear, the people, things that were happening outside, ambulances being brought, bringing patients in, and you'd know that if a plane had dropped a barrel bomb or a helicopter dropped, that there'd be significant amount of casualties being brought in. And I suppose 2013 was different to 2014. 2013 was such that there was, I called it in the book Sniper City, because there were so many snipers around, and they were picking innocent civilians off. We used to have on our little hospital, which was called M1, which is no longer there, unfortunately, 12 to 14 significant high-velocity, high-energy gunshot wounds per day. And when you imagine a small hospital dealing with, and the accident and emergency department had no doctors, they just had medical students who couldn't then complete their training, who were fantastic, who were able to put up drips, use their ultrasound probes to diagnose bleeding, and they would even tell me which patient that had to go to theatre. They were so good. And then it was a matter of training the doctors there to do the work and training them to be able to manage their injuries. And then going back there, and so they became a fantastic group of friends. They were amazing, and I'm still in contact with them. But in 2014, the situation was so significantly different, because there it was bombing of the Aleppo itself, and as our last speaker said, the beauty of Aleppo was totally destroyed. And the beauty of what was there was only on the front line, which I visited. I visited the old city and the old market and the mosque that was there. I visited them all. The mosque was completely destroyed. The Ayazad Mosque, which was, I think, I can't remember the name now of the person that was involved, but it was an 8th century mosque, completely destroyed. But the front line of it was still there. The market, the souk was still there, also destroyed. But you could see the beautiness of Aleppo, but around the other part of Aleppo was rubble, totally rubble, and there were hundreds of thousands of people living in this rubble. And of course, barrel bombs were being dropped every day on the city, and people were being brought in, multiple casualties. It was a dreadful time, and still I go back to it and sometimes lie in bed thinking about it. We had in civilian populations, when you think about it, 80% of the people that were brought into our hospital at that time were children, and 80% of the people I dealt with were children having been blown up, and that was very difficult to.
Could you save all of them?
No, because the problem is that when a bomb gets dropped on an intense civil society, so to speak, really, you get these clouds of dust that come up because concrete goes into, tiny dust particles. And of course, people are then affected with the fragmentation wounds and also need to breathe. So they breathe in all this concrete dust. And of course, concrete dust fills up your lungs, and there's nothing you can do about it. You can't hoover it out. So you get these children coming in covered in dust, and not only covered in dust, you try and ventilate them to put them to sleep, to try and do the operation, and you can't. And that was the issue. It was so devastatingly tragic to watch children that you could have saved in an environment if it was just gunshot wounds or something like that, but with an environment whereby it was complete blast injuries, the shock of the shockwave of the blast, plus all the dust you couldn't save. And our mortality rate went from 2013, which was down to 10%, went up to 90% in 2014. It was just tragic.
And you yourself, you had to exercise your I will help anybody, and the time that an ISIS leader got brought in.
Yeah, you have to treat as a humanitarian surgeon. You go out, and the funny thing is, as a humanitarian surgeon, you go and help probably a side. You can't not help a side, so to speak, really. But you go in there as neutral, apolitical. You're there just to help the person that's in front of you. And no matter who that person is that's brought in front of you, if it's a person from the opposition, if it's a person from the side that you're trying to save, or the side that they're protecting you for being in their environment, or even if it's an ISIS fighter, you've got a human being in front of you, and I, as a doctor, you can't make that decision that I'm not going to treat that person or that person. You've just got to treat whoever is in front of you.
So what happened when they brought in that ISIS fighter?
So the ISIS fighter was brought in. He was shot in the chest, and he was in the...
and you didn't know that, presumably?
No, I didn't know he was an ISIS fighter. And so I was sitting around downstairs in the operating theatre, and somebody said to me, David, there's somebody who's bleeding upstairs and has a significant chest drain with a gunshot wound to his chest. And of course, most of the injuries, even anywhere in London or whatever, if you've got a stab wound to the chest, you can deal with it most of the time with a chest drain. 95% of all chest injuries can be dealt with by a chest drain, unless...
By what? Chest drain?
Chest drain. So it's a drain that you put into the chest. You make a hole in the chest, you put this drain in, and it drains out the blood, and you wait to see what the hemodynamics of the patient are. If the patient is stable and you give a little bit of blood, and then, the bleeding most of the time stops. But sometimes the bleeding doesn't stop, and then you get a situation, if it's an arterial bleed or if it's a major venous bleed inside the chest from the heart or something like that, then the bottle of blood, the bottle that the chest drain's attached to, just gets filled up and filled up and filled up. And then you look at the hemodynamics, the patient's blood pressure's going down, he's obviously bleeding, exsanguinating. So that patient needs to go to the operating theatre. And at the time, of course, when you're a surgeon that, I've done it many times before, and then you say to the other doctors, have you ever done one of these before? And they say, no. Well, this is the time I'm going to teach you how to do it. And so that patient then came down in our little operating theatre, and we put him onto the side, and I said to Abu Wasim, who was one of the surgeons, I said, well, have you done it? No, I'll teach you. So make your incision here, make the incision here, put the retractor in, open it all up, and you see where it's all bleeding from, put the sucker in, and as this was going on, the doors of the operating theatre just bashed open like this, and 6 members of ISIS came into the operating theatre with their guns pointing at all of us in the operating theatre. And of course, what do you do in that situation, really? And then not only that, the head of the ISIS team came round to the front and was looking in, and then made comments in Chechen English. Why are you operating, on one of our brothers? And of course, at that time, you didn't know, and then it's a very difficult decision to make, really. What you're trying to do is protect yourself, protect your patient, because you do have to protect your patient. That's what you're there for. And so, long and short of it was that it was a very scary moment, a really scary moment. I mean, I'd be honest with you, I was shaking a bit. And legs were shaking a bit, arms were shaking a bit, and, what do you do in that situation? Well, I'm not very religious, but occasionally I think you do have to pray to God. And in that situation, I decided to pray to God. And I said to him, right, you need to help me. You really, really need to help me. It's true. I said, you really need to stop my hands from shaking, and you really need to stop me from shaking. And it's very strange how God works in mysterious ways, really. And although I could feel my legs bobbing up and down, my hands did start to get a little bit less shaky. And it was very important to get that stitch in that blood vessel to stop it from bleeding, because if I didn't, I could have torn it, it could have bled even more, and then of course they'd have said to us, well, you've just killed our brother, and who are you, and who are you, and who are you?
They didn't know you were English, presumably.
They didn't know I was English or Welsh. They didn't know I was...
Sorry. Sorry about the rugby.
No, they didn't know I was Welsh. And... but it is important to get that stitch in, which amazingly, and thank God, I got the stitch in, so everything was okay. Their phones went off, and they all left. And the Chechen, in fact, they were the worst group out at that time. The Chechen ISIS group were the worst. And
in what way the worst? The most violent?
Really dreadful. They were really violent and very dreadful. And a few weeks later, they came and dragged somebody down from the stairs who fractured both his legs, dragged him out of the hospital, and beheaded him in the street. They were a really dreadful group of people. And how do I think about saving the life of one of those sort of people? Well, I suppose I look at it that, that it was my job to save his life. And I've often been asked, well, you save somebody's life, you can go and kill somebody else. But that's not my role. And my role is to do what I feel necessary. And I hope that he would have realized that a Christian surgeon, had a help in helping some fundamental person change their views. I don't know, but that's the way I think about it these days.
Yeah, well, that's... so what do you do now? I mean, I was watching some videos of you today, of you sitting in, I don't know whether it's St. Mary's down the road, but watching someone operating in Syria and advising them over Skype. How does that work? I mean, it looked extremely...
Well, no, it's fantastic because
it
is... Well, again, this is another bittersweet story, which unfortunately Syria is a lot of bittersweet stories. Of course, I love helping people, and just a couple of days ago, I was cycling back from St. Mary's when I was on call, and at 6 o'clock in the evening, the phone goes off and said, "David, this is... no, are you Dr. Nott?" I went, "Yes." I was on my bicycle. And, "Are you a vascular surgeon?" "Well, I think so." And, "Well, we've got somebody who's bleeding to death at the Portland hospital. Can you come immediately?" So, "How long will you take?" "Well, 10 minutes." So I thought, and so I just started cycling there. And I used techniques which I'd learned in war surgery to stop the bleeding, to stop this patient who had... When I walked into the operating theatre, there was 5 surgeons standing there. There was 14 units of blood. The blood pressure was I looked at the monitor, and blood pressure normally is 120. This was her blood pressure was 40, and she was on her way out. So it is a matter...
What happened to her?
She had a gynecological procedure, and something terrible had happened, and a big blood vessel had been pulled off from somewhere deep down in her pelvis. Wow. So the only reason I'm telling you this is because there are...
Well, it's certainly a message to not go to the port.
Oh, that is true. That is true. Actually, I hope there's nobody here from the Portland hospital, but anyway. But you use techniques that you learn from war surgery, which are not available to anybody else, really. So if you use things, I said, have you got this PTFE felt, which is this special felt material? No, we haven't got it. Have you got this needle? No, we haven't got it. Okay, so I'll go back into war surgery mode. Right, give me a pair of scissors. So I cut off a piece of her posterior abdominal wall, it's called, to make into little bits of pledgets, they're called, which are these little bits of tissue, which if you have 2 bits of tissue and you push them together, and in the middle of it is a big blood vessel, and you push them together like this and put the stitch in, you can stop anything from bleeding. So I thought, right, big pair of scissors, make this, and everybody's watching, and as I put the needle in with my little pledget, and I put it through the other side, put it out, and went, and the bleeding stopped. And I went, right, thanks a lot then. But I would never have...
That's an astonishing story.
It's astonishing, but that's what's happened on Monday night. But the astonishing thing about it is that these techniques that you learn in war surgery are the techniques that you really need to know about as a surgeon, really. And
so why aren't people taught it? Why do you have to go to Aleppo to learn this?
That's a good question. But, we're supposed to have equipment in various hospitals, and sometimes you don't have them, and sometimes you need to save somebody's life within 5 minutes, or that patient will have died, and that patient no doubt will have died. So the techniques I use, I had taught other surgeons how to use when you don't have that equipment, when you don't have that things in front of you, when you don't have the right equipment, you have to use things that you would never use anywhere else, but that thing saved that person's life. But going back to Aleppo, going back to why do you training surgeons over Skype? Again, it's a fantastic thing to do. It's being able to train surgeons that you've trained before and being able then to teach them over Skype an operation. They phone me up saying, David, we've got a patient who's no jaw, they've lost his jaw. Can you help us? So I said, okay. So they sent me all the pictures. They even had a CT scan in Aleppo at the time. Syrian American Medical Society had even donated, and they even had the equipment over from Turkey to build a CT scan. So they had that in Aleppo. So he had a CT scan. He had no jaw. He had no nothing. But he was getting severe infections, and it was really, he was on his way out, so to speak, if nothing could be done. So so all his photographs came with me, and I took it to 10. If you take a picture of what should you do to 10 surgeons, you'll get 10 different answers. So I decided, forget all that. I'll show you how to do it. And there was this. So if you get a plate in a jaw, you can put a plate there, and you can take a pectoralis major flap, which is a special flap which you can create using the pectoralis major muscle here with a bit of skin on it. You can rotate it into the jaw and make a flap. So because over Skype, they'd never done it before, and also it was difficult to, over Skype, to tell people how to do things. They had me on a selfie stick in the middle of the operating theatre, and so I was looking into the operation, saying, right, make your cut here, make your cut there, do this, do that. And it was amazing. 8 hours later, the man had his jaw reconstructed. It was just fantastic. And I had never felt, so I remember going home to see Elly. I said, we've just done the most amazing thing today. We've reconstructed the man's jaw over Skype. But that was the sweet thing, apart from, but the bitter pill later was that I am 100% sure that the Skype coordinates from my office in London and the Skype coordinates from their hospital in Aleppo was being looked at, because 8 days later, a bunker busting bomb fell directly onto their operating theatre in exactly the same spot where the operation took place. So how do you still help people in war zones? The answer probably at the moment is no, because you don't want to put them into trouble and realize that their hospital, if you help them, their coordinates can get taken by somebody else. So it's a really bad thing to say.
That's a really bad note to leave it on, because we've now run out of time. Can you think of anything more
uplifting?
Cheerful to say?
Yes. I mean, the surgeons that we trained in Idlib this time, they sent me a message recently, a little child that came in, and they'd learned the techniques that we'd taught them, and they put in all the drains, and they'd even created their own little chest drain bottle for, I think the baby was 7 months old, and they had the picture of the baby and had a little picture of this little chest drain bottle, and they were so happy that they'd saved this baby's life and sent me a picture.
Good. Thank you.